Hello and welcome to the COMLEX Instant Review. Let's review some of the high-yield cases in pre- and post-operative care. The first case is going to talk about several things here. Which of the following changes are signs and symptoms associated with early sepsis? And so early sepsis, it's important to understand the definition. Is it respiratory alkalosis, ongoing requirement of fluid resuscitation, glucose intolerance, or narrowed arteriovenous oxygen difference? The answer here is going to be all of the above. So it's respiratory alkalosis, ongoing fluid requirements, glucose intolerance, and narrowed arteriovenous oxygen difference. So the answer is again all of the above. Now, it's important to identify and treat occult early sepsis before it progresses to a septic shock. An immunocompromised host may not manifest some of the more typical signs and symptoms like elevated temperature, white count, and so this forces you to focus on subtle signs. Early sepsis is a physiologically hyperdynamic, hypermetabolic state representing mainly catecholamines, cortisol, and other stress-related hormones. So patients who have a changing mental status, tachypnea, leading to respiratory alkalosis, and flushed skin are often at the earliest manifestations of sepsis. Also remember this, that intermittent hypotension requiring fluid resuscitation to maintain adequate urine output is also characteristic of sepsis. Also, hyperglycemia and insulin resistance during sepsis are common in both diabetics and non-diabetics. And the cardiovascular response to early sepsis is generally characterized by an increase in cardiac output, decrease in systemic vascular resistance, and decreased peripheral utilization of oxygen, which yields a decreased arteriovenous oxygen difference. So that's a key fact, and good luck in your board preparations. Please visit comlexflashcards.com for additional resources.